So I'd like to now hand over to our third speaker, who is Dr. Francine Marques.
Oh, hello. Hi, Vanessa, and hi, everybody else. First of all, I'd like to thank Vanessa and Ovarian Cancer Australia for the invitation to talk to you today. And I also thank Brain and Martha for the very insightful talk. They covered a lot of things that I was going to mention, so they made my job much easier. So as Vanessa mentioned, I'm an ovarian cancer survivor. So I'll briefly tell you what happened to me, how I found out, and then things that I found along the way, issues that I had, and hopefully some solutions as well for some of the problems being diagnosed with ovarian cancer at a young age. So I was born in Brazil. I have been in Australia for 11 years, and it's home here now for me. And my mom had breast and ovarian cancer. And when I was in Brazil about 4 years ago, doing a normal checkup with my sister, who is a gynecologist there, she found I had a small cyst in one of my ovaries, and it was a benign cyst. But because I was going to be here, she asked me to go to the GP and monitor every year to make sure it wasn't growing. And 2 years later, I went back to the GP, so in 2015, and did the ultrasound and came back to get the results, thinking everything was going to be fine, and also that the cyst on that side was still the same size, nothing had changed, but there was something else on the other side that was suspicious. So I was sent to a gynecologist here in Australia, who told me I had just a cyst. There was nothing for me to worry about, and I could just repeat the ultrasound in 6 months. And lucky for me, my sister didn't like the images I had sent her, like the photos, so she asked me to go back to Brazil and do keyhole surgery to remove the cyst. And during the surgery, when they opened up, they found out I had no cyst. I actually had ovarian cancer. So everything moved really quickly. Because I did the keyhole surgery on a Friday. On Tuesday, the pathology results came back. On Wednesday, I was told by the doctor that I had ovarian cancer. And on Thursday, we had another surgery then to remove everything. So I was diagnosed with stage 3, so quite advanced. And because of that, we removed both ovaries, my uterus, omentum, the lining of the cavity and everything else. So I didn't have any kids beforehand. I was only 31, and because of that, I can't have kids naturally. But I'll tell you a bit more some strategies that we have been trying to use to deal with that. So what my treatment involved were the 2 surgeries, as I mentioned, and then I did 6 cycles of paclitaxel and carboplatin that lasted about 5 months altogether. And during the beginning of the chemo, my veins were really hard to get. So the doctors thought it was a good idea to put a 4-day cath, which I would highly recommend to any other patient, because then they can inject the chemo and they can extract blood directly from that. Makes your life much easier. However, in my case, they had issues during the procedure, and I ended up with a punctured lung. And because of that, my lung collapsed, and I ended up in the hospital for a week trying to fix it. So that wasn't very nice. Something else that I did during the beginning of chemo was to use a scalp cooling system to try to keep my hair, which I also would highly recommend. Halfway through the treatment, it stopped working, and I started losing a lot of hair. And because of that, I still had to shave and wear a wig and all of that. But like you can see in the photos, it does get quite cold. But I would highly recommend, if you have the option, to at least try, because it might be a way of trying to keep your own hair. And I also found during chemo that there were several issues that I couldn't find good, reliable information about. You also leave your first chemo session with a list of problems, and side effects that you're going to have, but nobody tells you how to actually deal with them. And because of that, and being a medical researcher, I decided to put together a blog called Chemo and Beauty. So in this blog, I'll share tips on well-being and beauty for other cancer patients. And I'm also always happy to help, like to share my story, to talk to people, to listen to you as well. So if you ever need anything, please feel free to contact me. You can contact me through the blog, through Facebook, even like my email, my mobile. I'm very happy to help other cancer patients. And so I finished my chemo 2 years, and tomorrow will be 2 years and 1 month ago. I am trying to move on with life, so I haven't updated the blog as much as I wish I would. And the reason for that as well, because life got busy. We bought a puppy, Lindy. You can send a photo. She's very, very cute. She gets away with a lot of stuff that she shouldn't. We also got married in June this year, so the photo is from our wedding in Portugal. And we bought a house recently too, which is a new house for us, old house though, and requires a lot of work. And I still have regular checkups. Up to last month, I had a checkup every 3 or 4 months, which every time you're going to the checkup, it's very stressful. There's a lot of anxiety around what if this time it's going to be bad, what do we do? There's like, of course, the stress related to like having a wedding booked, just like buying a house and all of that. But I decided that I was not going to stop living my life because of cancer and risk of recurrence. And also, of course, long-term side effects of the treatment, including being on menopause. I am taking HRT now. Also some side effects such as the so-called chemo brain, which I'm not sure how much it is still because of the chemo or because of menopause or who knows what. But that I still have to deal with on a daily basis. And what I want to talk to you then is some factors that I wish like other people had told me in the beginning, and I wish cancer patients were told as well as a group. We talk a lot about like chance of 5-year survival and all of that, and I think we forget a bit that we are all unique people. We all have a different story. We all have a different health status at the time of diagnosis, and we shouldn't be treated as populations. Like we should really be having our risk individualized. So don't go to Google. The statistics in general are not very good. So try to discuss with your doctor who know the best, like for your case, what like your chances of recurrence and chances of cure and so on are. Also, side effects of treatment can be debilitating. I was like young, healthy. I thought at the time of the diagnosis I had a lot of energy, and I didn't think that fatigue. And when the nurse told me there might be days you might not be able to get out of bed, I didn't think that was going to happen to me, but it did. So they can be like the side effects can be debilitating, and they're real. So just allow yourself to take the time to actually go through it and recover well. And some of the side effects might last a long time after the treatment is over. I can tell you that I felt I had my energy levels back about a year later after I had finished chemo. And even there's still days that I might still feel exhausted from like, it comes from nowhere. And they just get more spaced out now. But yeah, some of the side effects can last for a very long year, including also, of course, menopause is permanent. And also know that not all sources of information are reliable. So know where to look for information. Contact Ovarian Cancer Australia, Cancer Council as well. Like if you understand a bit about medical research, you can read like scientific papers, which is the best source of information directly from the source. But just be careful with a lot of bogus websites and a lot of Mel Gibsons and so on that will tell you that you can drink lemon or buy cab or like do this or that to get cured, because that's not all true. There is no evidence for that. And I think that also puts a lot of stress on us because in the end of the day, you start feeling guilty about not doing all those things as well, which there's no evidence against for us to be doing. And in terms of then some solutions for the problems that we do face as young patients of ovarian cancer is one of the main issues, I think it's that feeling normal again. And I know that for me, like having my hair back, having like my energy levels, going back to my normal lifestyle, these were like priorities for me. However, of course, not always is achievable in a short term. And what I like to say is that we need to learn how to have our new normal, because sometimes the old, like our old selves, we can't just go back. However, try to enjoy now. Think about like your new life, like take baby steps. Every day is a wonderful day. Be grateful. Find new hobbies, things you always wanted to do and maybe before you didn't prioritize, you didn't have time. So these are all things that you can try to recreate normal. And in terms of body image and self-esteem, like there are issues related to weight gain. It's actually quite normal. And I remember before chemo, I always thought that patients with cancer would lose weight, but it's more common that patients will put on weight. Now, of course, having a healthy diet, exercising, these will always help you to manage your body weight and also to improve your lifestyle and decrease chance of recurrence and any type of cancer and also heart disease. In terms of the hair, you need a lot of patience. I can tell you now that I'm 2 years after chemo that my hair is touching my shoulders. It took a long time for the hair to grow and for me to be happy about it. I think the first 6 to 12 months were the hardest because the hair was short and it came back a different color, different texture. So you have to learn how to deal with a different length and then the texture and the color. And it is hard at times, but just keep thinking that like it's a long process, but you get there and you'll be happy with the hair again. Like the color came back to normal after now 2 years. The texture as well came back to normal. So don't give up on your hair and on yourself. And also, for a lot of these things that I'm discussing, there'll be lots of blogs that I have written about how to deal with these things. So go and check, and please, contact me if you want any information more, if you want to discuss anything. Then, in terms of menopause, it was quite difficult to deal with, especially because, like, being young. I was in a relationship at the time and all of that. And I remember that nobody mentioned to me about HRT being an option. It was good that Martha did mention. But what happened was that I spoke to someone that had ovarian cancer that I met, and she was young as well, and she told me she was a GP and she was on HRT. So that really showed me that it was something that I could do as well. So I went on and asked my oncogynecologist, and she agreed that it was a good idea. So I have been on HRT for the past 2 years, and I really don't regret it. In terms of infertility, I also ask about options for fertility preservation. Again, when we're diagnosed, sometimes it's the last thing that we're thinking about, and it all happens so fast that you lose a little bit the control that you have over your life. What happened in my case was that when I was diagnosed, I was still in Brazil, and I went through the second surgery there. And my sister had spoken to one of her supervisors who was owner of a fertility clinic, and they offered to come over during my surgery and collect my ovarian tissue. There is still not enough I think there's not enough methods available to actually generate eggs from ovarian tissue in vitro, but we hope that in the future, in the near future, there will be, and we'll need a surrogate mother as well, which is, I know, tough, but we'll hope we'll find one when the time is right. So remember to ask whether there is an option for you to preserve ovarian tissue, eggs, or something like that. And in terms of something that absolutely nobody talks to you during the whole treatment, and you can, again, ask, is about sex life. So my sister being a gynecologist, like, we're close enough for me to open up with her and ask about it. But I know that, like, no oncologist or even the gynecologist that I'm saying here, GP or anyone else, ever asked. So remember, you have the option to do that. You can have sex during your treatment. You can have sex after your treatment if you feel like it. If you don't feel like it, you shouldn't be forced to. But yeah, again, being on the HRT or even just using local hormone might be able to help with that too. And again, as Brenda mentioned, feeling isolated, because it is quite common because we are young. Most of our friends at this stage, they are like doing what people in their 20s, 30s, and 40s usually do. They're like getting married, they're moving on with their lives, having kids, and sometimes we have to face, like, for example, in my case, that I can't have kids, or at least not that easily. So there is always issues that we have to face, but there is always support groups and other people that you should be able to talk to. There's a large community of cancer survivors in general, not specifically to ovarian cancer, and a lot of us who have similar issues, so you could always go and talk to other people in the same age. And of course, also issues related to finance, because you might need to stop working. In my case, and I know that that's not for everybody, I decided that I wanted to try to keep working part-time because I didn't want to be just home thinking about my treatment, thinking about cancer, feeling sorry for myself. But I know that sometimes you're too unwell to do that. So if you don't have a flexible job, that might be more difficult. And dealing with the anxiety and fear that also are associated with the whole diagnosis, the whole treatment, and like every single step of the treatment and after as well, when you're just monitoring if the cancer is back and you're still free of cancer. I know that that's also very difficult. The best way that I find is distracting myself and really just avoiding thinking about it, but just moving on with life. And I decided that I didn't want cancer to control my life. It had already taken so much, and I think that's really helped so far. And finally, remember to ask for help. Help at home with like getting your daily activities done. Help like with cleaning, with cooking. Like when people offer you help, say yes and tell them exactly what you want, because some people want your help but they don't know what to do. So tell them how they can help you. But also ask for help like from the Ovarian Cancer Australia, from the Cancer Council, from like other sources of like that you can get information that can help you as well, make you informed decisions, and just like still enjoy life. I think that was all for me, but as I said, again, please feel free to contact me if there's anything else I can help you with.
Thank you so much, Dr. Marques, for that incredible insight into your journey and your cancer experience. Absolutely incredible. We do have a couple of questions for you, if you don't mind answering.
Yes,
one of them is, what were your main questions when you were first diagnosed? What were your questions that you wanted to know?
I remember as soon as the doctor told me about like the diagnosis, I asked him, and it was all a series of horrendous answers. I asked him, I said, so do I need to have another surgery? And he says, yes. Do I need to have both ovaries removed? Yes. Am I going to be on menopause? Yes. Do I need to do chemo? Yes. Am I going to lose my hair? Yes. It was everything like very negative. I think like there were questions that I didn't know about, like the preservation of my ovaries that I would like to have asked at the time, but I was lucky that someone else came along and helped me with that. Also being able to use the hormone replacement therapy, I think that was very important to improve my life quality after cancer treatment. And just like knowing that you still can have mostly a normal life even during chemo. And that was not something that I expected, but I was still happy, like as you can see in the photos, still like going to the beach, spending a lot of time with my friends and family, and that actually brought us a lot closer, which was really good.
That's fantastic. And did you feel there were areas that you did need more support in? I know you've mentioned some of them already in your presentation, but any in particular?
I think like going and seeing someone, like I saw a therapist that I hadn't seen before, was helpful, because there are things sometimes that you don't want to tell anyone else, like how you might be afraid, of dying and what, if you go down that path, like what is going to happen. Things like that sometimes you don't want to tell your family or friends. Also just being able to talk about how you feel, and sometimes the only other people that might understand it is someone that has gone through something similar. So connecting with someone else that is going through something, similar as you is helpful too.
That's great. Thank you so much. Does anyone else have any other questions? If you do, just type them into the chat box in the bottom left-hand corner. No, doesn't seem like we do. Okay, well, if there are no more questions, we'll leave it there. Once again, I'd like to say a big thank you to our speakers, Professor Martha Hickey, Dr. Brenda Poulet, and Dr. Francine Marques. We really appreciate the information that you've shared and the time that you've given us today. Thank you everyone for being on this webinar. We really hope you found it valuable. The recording of the webinar will be posted on our website, and you will receive an email with a link to the recording in the next few days. In a moment, just when I finish up, you will be directed to an evaluation form. If you could please take a moment to fill that in, as your feedback is extremely important to us and will help us to plan and develop future webinars. And if you do have any other questions that you would like addressed, please don't hesitate to contact our information and support line on 1300 660 334. Lastly, the support team at OCA will be continuing to provide support specifically to younger women in the coming months. So please look out for an email from us asking for your suggestions around what would be most useful to you. So thank you again, everyone, for being on the webinar, and we hope to see you for the first webinar of 2018. Have a great day. Goodbye.